It was an absolute nightmare.
Marlene Cox recalls what she says was an unpleasant experience her mother had at Glen Burnie Rehab and Nursing Center in Henrico. It was a short stay back in 2021. Cox removed her mom after less than a week.
I was able to get her transferred because it was so awful, and that 5 days seemed like forever.
Among her complaints, which she documented in notes, she says her mother's call bell did not work and she was left to sit in her urine for hours without getting cleaned.
They didn't even come in to check on her to see how she was doing.
Virginia Department of Health records show that this was not an isolated incident. During its most recent standard inspection in 2024, the state found that Glen Burnie failed to provide regular incontinence care, with one resident reporting, "We have to call them to come when we are wet." And earlier this month, facility spokesperson Mindy Barnett says the call bell hardware went down at the nurses' station, but said replacement parts were promptly ordered and interim measures were put in place so residents could still get attention when needed.
It really hurts to know that, this much time has gone past and they're still operating the same way.
Glen Burnie is a for-profit nursing home operated by Medical Facilities of America, a chain that runs more than 30 other facilities across Virginia, including Colonial Heights, Westport, and Henrico Health and Rehab, which have all been on the receiving end of recent regulatory enforcement actions. It has 1-star rated quality and low staffing levels according to Medicare, and it has 3 times the number of violations on inspection reports compared to the average facility in Virginia. Now, VDH made 4 complaint visits to Glen Burnie between January and April of this year, and here's what they found. An intoxicated nursing staff member allegedly verbally abused 2 residents by screaming and cursing at them, telling one of them, "If you take your brief off again, I'm going to blank you up." The same staffer also stated he over-medicated a resident to put her down. The facility terminated that employee. Glen Burnie was also cited for failing to provide high-quality care when staff were made aware of a possible resident overdose, but the nurse practitioner only gave telephone orders to continue monitoring the patient. That resident's family took it into their own hands to transport her to a hospital. Additionally, the facility failed to maintain a clean and dignified room, failed to properly administer medications and treatments for multiple residents, and failed to ensure that a patient was seen by a doctor within a required 60-day time frame. The most serious violation that Glen Burnie faced was a failure to investigate and prevent fires that were set by a cognitively impaired resident. In January, the resident, who was already known to pose a safety risk due to his tendency to collect and use lighters, was believed to have lit a mattress in his room on fire and burned a curtain. At the time, the facility said it would implement interventions like increased supervision and inspections of his room. However, VDH did not find evidence that those measures were actually happening, and in March, the resident started another fire using toilet paper in his bathroom.
It just astounds me that a facility can still be functioning and somebody's not sounding some alarms or the red flags aren't being raised to take care of that.
Federal regulators with CMS told Glen Burnie it would deny Medicare and Medicaid payments for all new admissions beginning May 30th. Data shows a fine has also been imposed on the facility, but the amount is unclear.
I think they should be held accountable. I think they should be cited. If somebody can't turn Glen Burnie around, I think the doors need to be closed.
In response to the most recent inspection findings, Glen Burnie spokesperson Mindy Barnett tells me, "Our primary commitment is to the well-being and dignity of our residents. We are actively engaged with CMS and are maintaining open communication regarding the recent citations and necessary remedies. We are committed to full compliance. Our dedicated team is working tirelessly to enhance training and education, aiming to prevent any future issues and to ensure the highest standards of care are always met, to prioritize the safety and comfort of our current residents and provide quality care they deserve. We have temporarily paused new admissions." In Henrico County, I'm Tyler Lane for CBS 6 News.